You're listening to Utah Public Radio. I'm Shalane Smith-Needham. Thanks for tuning in for USU Extension's Education Highlight. This spring, the CDC announced that the highly pathogenic avian influenza has infected a person in the U.S. Should we worry about this virus spreading to humans? What do we need to know about this outbreak of avian influenza this time around? Joining us is Dr. Bruce Richards, Assistant Professor and Dairy Extension Specialist at Utah State University. Thanks for being here.
Glad to be here.
First, tell us more about bird flu, what it is, and what birds are mostly affected by this virus, and where are we seeing those infections?
So, bird flu is a virus. Specifically, it's H5N1 is the virus. It's been in the bird population for years. When it's affected in poultry, it's highly contagious, and they have to depopulate the flocks of herds. So, recently, it passed from the birds into dairy cattle, and it's been discovered in dairy cattle. The good news is that when it's in dairy cattle, we don't have to depopulate the herds because the cows recover after a couple of weeks. They recover and get better again. They drop in milk production for those 2 weeks that they are infected, but they do make a full recovery. So we don't have to depopulate herds, which is really good news.
And is this virus mutating? Is it changing at all since the last time?
So far, it's the same H5N1 that was in poultry. That's the same strain that they found in dairy cows.
And how is this affecting the dairy industry?
So far, it's when it gets into a herd, it's only about 10% of the cows in the herd that's affected. We only have a handful of states where they've found herds that are positive for avian influenza thus far. And so the herds that it affects, it's a big effect because those cows, 10% of their cows stop producing milk, and that's a big impact. But the overall dairy industry, it has not had a big effect. And typically in the spring, we have a surplus of milk just because of seasonal variation. We tend to get more milk in the spring, and so far we have not seen a decrease in milk production nationwide.
Well, on a lot of our minds, with the CDC announcement of a person being infected by this virus, should we be concerned about it spreading to humans, and should we also be concerned about it being in our foods?
So far, the one positive case where it was found in a human was someone that worked closely with the dairy cattle. It's an airborne virus as well as passed through other means, but the receptors in human lungs are lower in the lungs, and so it is not easy to get it from cows. It's possible, we've seen that, but it's not likely unless you're working closely with the animals to be passed to humans. As far as from food, it is carried in milk. And so milk from infected cows is discarded. It doesn't enter the food cycle. Should a cow be positive that's not detected, it is, like all viruses and bacteria, it's killed by pasteurization. So pasteurized milk is still safe to drink, along with properly cooked meat is still safe to consume as well.
Well, finally, what can we do to help prevent the spread of this virus, and what can we do to protect ourselves? In particular, what do dairy workers do to protect themselves working directly in contact with these birds?
Yeah, a good question. As when we had the COVID outbreak, wearing masks can help prevent the aerosolization of viruses. Typically, though, we haven't seen widespread to humans yet, and so just proper hygiene, washing of hands is a good idea. In the milking parlor, using rubber gloves, for example, when you're handling or working with animals is important. Good biosecurity practices. As far as from the dairy farmer perspective, limiting transportation of animals, especially from farm to farm, is important. And if you do need to move your animals, test them before you move them to another facility. The USDA just put in that requirement, especially if you're crossing state borders. They need to be tested before they can cross state borders. And then doing what you can to limit the amount of contact with birds, especially wild birds on the dairy farm, to keep them out of the feed, keep them out of the barns as much as you're able to do will help to limit the transmission of the disease.
Well, Dr. Bruce Richards, thank you so much for joining us today and sharing your knowledge on this topic with us.
You're welcome. Thanks for having me.
And thank you for tuning in this week for another USU Extension Education Highlight. I'm Shalane Smith-Needham.